Hello, it's Adam here from Alto Hearing in Lutterworth, UK. Today I'm going to show you quite a tricky earwax removal that was conducted recently by our ear specialist Mariia. Now, Mariia joined our team recently as she's staying here in the UK with a local family. Originally she's from Ukraine, and over in the Ukraine she works as a doctor in ENT. However, currently she's not able to work as a doctor in the UK, so we were delighted to welcome her to Alto. Mariia is highly skilled in endoscopic removal of wax, and this is a case she's seen involving a lady in her 90s who's got a very narrow ear canal. Now, narrow ear canals can be tricky as they're often likely to accumulate wax, and then trying to remove it can be difficult as you have less field of view, you're working in a tight space, and this is why we use the endoscope here, as out of all our equipment it takes up the least space physically and is quite good for working in these confined ear canals. Now, this lady wasn't hearing anything out of this ear, and she even told us that she'd had a few complaints from the neighbours that the TV was a bit too loud. So we were really desperate to try and put this right for her. You can see in this video the wax is sitting quite deep and is fairly dry. So what Mariia tries to do is just lift it gently from the sides and try and get a grip on it to gently pull it out using the Zollner tube. It's not an easy one, and when conducting this procedure you have to be patient. You really want to put the Zollner tube in there and just lift the wax straight out, but when it's compacted and dry you have to be really patient and gently try and lift the wax. Sometimes it can take quite a long time. I think the whole procedure for this ear took about 13 or 14 minutes. And whilst conducting the procedure, the lady is being reassured at all times, and she can even see what's going on as we have the endoscope hooked up to a large TV in the clinic room. Now we start to see some signs of progress, but it's still quite deep down the ear and dry, so we have to be incredibly careful not to touch the side of the ear canals, as this can cause discomfort. You'll see Mariia take regular pauses now and then, and this is because microsuction can be quite noisy, so it's good to give the person a break. Now eventually we start to see a little bit more movement, and though the person had used a little bit of olive oil prior to the appointment, Mariia just adds a little bit of sodium bicarbonate in there to help break it down and see if it gives her something to latch onto. And it works really well, and she's able to get a good latch onto the wax and lift it straight out. A little bit of a tidy up and the wax is clear. I really hope you enjoyed getting a bit of an insight into our clinic at Alto. If you'd like to see more wax removal videos, please give the video a like and subscribe to our channel for more content coming soon.